Right. Good afternoon, everybody. We are going to go ahead and get started. Thanks for joining Caracon Symposium 2025. The fight isn't over. We're happy that you're able to join us again today. So we are Caracol. We are Greater Cincinnati's HIV nonprofit devoted to positively changing lives in the fight against HIV through prevention, housing, and care. We're in a Zoom room today, and hopefully we won't experience any technical issues like we have earlier in the week. If you have questions or want to engage with other audience members, please use the chat. But if you have questions specifically for the panelists and the presenters, please put those in the Q&A. We do have someone monitoring those for you. And a special thank you to our presenting partners, Maytech, the Midwest AIDS Training and Education Center, and Hamilton County Public Health. Big thank you for all of their help and support in this week's conference. Also, a special thank you to our sponsor, who is Gilead. A thank you to our exhibitors. First exhibitor is Merck, and our other exhibitor is Vive. Thank you to them. And we are offering continuing education credits today. To receive those credits, you need to be in the room for at least 60 minutes and complete the evaluation that will be put in the chat and should pop up for you as you exit the room. And complete that by 5 p.m. today, and then you'll be eligible for those credits. So for today's topic, I'm really excited to announce this topic. So we're going to be talking about from the exam rooms to living rooms, the shift towards HIV self-testing. I've got my coworker, Jamar Jackson, who's going to be presenting, and someone from KW2, Josh Goron, who has partnered with Caracol a lot over the years around this effort, and they're both going to talk about what our HIV self-testing program looks like. So with that, I'll hand it over to Jamar and Josh.
Hello, good afternoon, everyone. Like Adam said, my name is Jamar Jackson, and I am HIV testing coordinator here at Caracol. And I'm also very excited to talk to you about our self-testing program today as well. So let's get started. Okay. So Caracol's HIV self-testing program, we were fortunate enough to launch this program in November of 2022. We received a year-long grant from the CDC Foundation that funded our HIV self-testing kits. And we were able to make that a free service for clients to order and online through our website, caracol.org. And we also had them in person for all of our outreach efforts to give to people in our community and also in the surrounding areas of Hamilton County, Butler County, and Brown County. So after that year-long grant that we got from the CDC, we were fortunate enough to continue the program because it did become so popular. We were able to self-fund our program starting in 2024. And once we were able to do that, we saw a very huge uptick in demand for our at-home testing kits, mainly because we did a lot of grassroots work with that year-long CDC grant. So we were able to get the word out about our self-kits a lot more. And with the program gaining popularity, we were able to get those test kits ourselves and continue that program to give out to people in the community as well. And then through our in-person outreach and our mail-in orders, currently up to September 2025, we have distributed over 2,500 test kits, mainly in the greater Cincinnati area, and also through our tri-state regions of Indiana and Kentucky as well. So this is just a slide that shows a little bit of data about the marginalized groups that people identified as, people who use our test kits in our community. So as you can see here, we had a large number of people who identified themselves as heterosexual, with them being our largest group of people who actually ordered test kits or were given a test kit within the community. 27% of those people identified themselves as a member of the LGBTQ community. 13% of people identify themselves as people who inject drugs, and they also may fall under one of those other categories of heterosexual or LGBTQ as well. But we wanted to specifically highlight people who injected drugs as well, because we also know that that is a very rapid way for HIV to spread as well amongst people who inject drugs. So it was very important for us to collect that data as well. And then the last percentage of people, which comes in at 10%, were just people who simply declined to answer the demographic information, or they just selected other as if they did not fall into any of the categories that were specified on the data sheet. So this is just a little bit of data about the communities there, and we can go to the next slide with more data. So we're going to break this part down into two different sections because, like I said before, we distributed our at-home test kits in two different ways. We distributed our test kits through outreach, so that included a lot of our staff taking them to special events that Caracon was a part of, taking them to like our weekly outreach sites. We also have a mobile unit that we use outreach for testing. So we pretty much took these around the community. And as you can see, the pie charts here just shows the race and ages of the people who we distribute those tests to through our outreach efforts. And then also, as you can see, this data ranges from the start of our program in November of 2022, and it went all the way up just until last month, September 2025. So as you can see with the race demographic, a large majority of people who identify themselves as white and Caucasian come in at 63%. They were the most receptive to receiving the at-home test kits through our outreach. And then with the African American community coming in right behind them at 31%. And then on the flip side of that, if you see the gender pie chart there on the right, as you see, we had a large presence of course, female and males identifiers, but we had a lot more females who were susceptible to taking our test kits from us through outreach. And not to say like, you know, people, like I said, they also did not report, they did not want to report any demographic data. So we have that there in the corner as the 1%, which is a very low compared to, you know, any other like type of data that you would want to collect for test kits. But you know, a lot of people were a lot more receptive to giving out information when it came to us personally handing them out during outreach. And then we can go to the next slide. And this slide is going to show you the demographic information for our second method of distribution, which is our mail-in order data. So it's a little bit different, but as you can see, not too much. With the race demographic, we still had a large amount of people who identified as white or Caucasian at 53%, and then we also had the African American community coming in on second as well with 37%. And one thing that I do want to highlight about the data with the race demographic is that we do realize that the smaller amounts, so the smaller percentages of like Hispanic with 4 and Asian with 3, we're realizing that maybe we're trying to develop new ways to reach these communities, to get them to know about the test kits, but also for them to get a little bit more HIV education, which will lead to them possibly ordering or receiving test kits through us through mail or through outreach. I'm sorry. So we are doing a lot more outreach amongst these communities and just putting the word out with posters and even by word of mouth, just to let them know that the test kits are available and to just get more information on those. And then on the other side of that, on the right side, we have the gender of people who order test kits from us. So as you can see, the female population at 52% is our highest population of those who have ordered test kits from us through our website. And then we also have a 44% of males. We have 2% with transgender who identified as that. And then we also have 2% of people who identified as non-binary or genderqueer. And the one thing that I love about this is that with the mail-in orders, no one declined to answer our questions. So we were able to get really good information and really good data, especially from the people who placed a mail-in order with us, which is interesting because we kind of ask for a little bit more information with the mail-in orders than we do with outreach. And we're also going to get into some of that data as well. So we can go over to, oh, and also want to, sorry, point out as well with our state percentage, with the tri-state area that I did mention, that we do service with our test kits. 89% of them came from Ohio. Of course, we are based in Cincinnati, Ohio. So it was a little bit easier to spread the word around where we are. But it was also very interesting to see that in the tri-state area that we also had people from Kentucky and Indiana find out about our test kits and order them from us as well. So I also just wanted to point that out to you all as well. All right, so back to speaking on the data collection that we collected for information for our test kit program. When we started the program in 2022 with the CDC Foundation, they actually had requirements for us to collect certain data. Unfortunately, with the CDC grant, well, I won't say unfortunately, but with the CDC grant, we were not able to choose the information that we wanted to select. The CDC required us to collect a person's name, their age and their birthday, their gender, their zip code, contact information, and all of their risk factors of why they would be receiving a at-home test kit from us. So with that information, we were able to do really good numbers and actually get the program off the ground, get it running, and get people interested in our test kits. But I will say that when we switched over to our own self-funded test kits, we were able to then select the information that we wanted to use and the information we wanted to collect for our own data. We decided to basically get rid of a lot of the personal information that we were asking people initially, because we did find that with the CDC grant, asking a lot of that personal information kind of hindered people from wanting to receive test kits from us. Just think of it as like, somebody's offering you something for free, but then you have to turn around and give all of this personal information about yourself. Then you kind of start to feel like, well, how is this free if I have to like literally give my life story to receive this? So we took that into consideration. And so when we started funding our own program, we only required people to give us their zip code, their age range. So instead of giving us their exact birthday and their exact age, we broadened the horizon to put them in different age ranges, so that way they felt a little more comfortable disclosing that information to us. And then one thing we also decided to do as well, which played a big part in the feedback that we got from our program, was to make our contact information optional. We mainly chose to do that because when it was required to get contact information from people, it was a very good idea because we were able to reach out to individuals just to basically give them that follow up, give them like any type of um, resources they needed, any type of referrals. We were also able to do like any type of counseling they needed, education services, which is all well and good. But one thing that we did find is that we did not receive a lot of people who like answered or reached out to any of our follow-ups, because we realized that a lot of people like may have just taken the test kit with them. They may not have taken it at that moment. They may have just got it for someone else and they didn't know how the other person tested or anything like that. So we made the contact information optional, and it actually helped because it gave clients, a little bit of the power to reach out and get some information on their own, instead of it kind of feeling like it's being forced down their throats or anything. So it just gave like a more client focused approach to letting them get the test kit, letting them kind of discover it and figure it out for themselves. And then we provide the information for them to contact us if they need anything that we can offer after the test has been performed on themselves. So we really found out that the least information that we ask people, the more willing they are to take the test kit and to, just get more information about any services that Caracon has to offer. So this basically describes, in our opinion, or in the data that we also collected, why do people self-test more than they are, getting tested at clinics and through Caracol and, doctors' offices and emergency rooms. So the purpose of testing, which we kind of figured out, we're in a new day and age here, is that most people are using our test kits or any test kit that you can test yourself for preventative testing. So what that means is that we're realizing that a lot more people are using these test kits to, just make sure that they're staying up on their sexual health. They're making sure that they're doing regular HIV checkups on themselves. And they also are able to use these in intimate settings with their partners, just to make sure that they're staying up on their sexual health and making sure that, it's preventative and not used in emergent situations. Which goes into our next point that with in-person testing, while it is still very important, it just seems like this day and age that more people are just getting in-person HIV testing after experiencing like high-risk situations. They may be in an emergent situation where they feel like, I need to know now. I need to know in this moment, and I can't handle this on my own. So I'm going to go get tested and actually be face to face with someone because of more high risk situations. While that is not the case for like every in person test, because a lot of people also still use in person testing for preventative testing as well, we've just kind of noticed that more people are only starting to really, they're not using the test kits for emergent situations. Those are more so just for, I'm going to sit this to the side and use it when I need it type of deal. When more people come in, like maybe after having like risky behaviors, like 2 weeks prior or like a month prior, and they want to know like right then and there, rapid testing, how can I go and get other referrals and resources that they're coming in person to get that because they need that one-on-one connection with someone who is very knowledgeable and that can help them navigate through their result. And then one thing that I think COVID was not good at all, but one thing that I think did come from COVID that helped us out with this is that with the rise of self-testing COVID-19 tests, it just made a lot more people feel comfortable testing themselves for, viruses and, bacterial infections that they may have or may have contracted. So we feel like after the rise of the COVID-19 testing, a lot more people, it felt a little normalized to self-test themselves for HIV, for COVID and like the flu and everything like that. So it just made it a lot more streamlined for these HIV test kits to be given out to people and for them to feel a lot more comfortable with it because they're also getting to test themselves in private spaces, and not so much in a public setting to where you may go to a hospital and they know like, oh, you're going into this room here, so we know what you're getting tested for, and that can draw people away from getting tested for HIV as well. So these test kits come in handy when it comes for people wanting to test themselves in the private of their own home. And then on the flip side of that, we all know what's going on with healthcare and everything right now. It's outrageous to say the least. But people realize that and realize that healthcare costs have risen extremely high. And with this being a free service, and also a service that does not come out of pocket for anyone, it's just a more affordable option for them to stay up on their HIV testing. And it also lets people who may not have certain HIV resources in their area to reach out to us to get a free test kit from us and also provide the information that they may need for follow up or anything like that. And then with the privacy and discretion piece of it, like I spoke on before, a lot more people are feeling more comfortable testing themselves in the privacy of their own home. So one thing that we try to do with that is to go to these groups. We meet people where they are. So we've done a lot of bar outreach, where we know that people are, out having fun, having a good time. You may have some more fun after you leave the bar. So why not, take a HIV self-testing kit with you so that way you already have it on hand. So we have partnered with a lot of different bars and nightlife spaces, So that way we were initially there to give the test kits out to people. We literally had like resources and referrals on hand. But one thing we realized with like a trial and error type deal is that people are more comfortable taking a test kit when it's just there and available, opposed to someone being there handing it to them directly. So we kind of took that information, we took that observation, and we decided to partner with these places. And instead of just making it like a night for us to be out and working, we've decided to partner with them, give these places trainings on how to like, administer or distribute these test kits to their patrons. So that way, if they had any questions after picking one up, they could just go right to a bartender or someone who works at the bar, and they would be able to kind of navigate them through that. And I feel like we felt like that was a little bit more personal for clients who were taking those because they may frequent these places very often, and they may be more comfortable with like workers who are there and things like that to get that information about the test kits than just one of us who are on staff that's there to work, that they may not know so well. And we found out that people are more susceptible to taking the test kits when they're just out readily and available, just sitting on the table somewhere, than having one of us behind the table handing them out to them. So we also realized that, and we decided to go that route, and we have had a tremendous outcome with that as well. And so what makes these test kits so simple and reliable is that they are quick and easy. So these are FDA approved or quick single used oral tests. So there is no needles. You don't have to deal with any blood. There's nothing that will put you in pain. The tests just use a simple mouth swab for the saliva DNA that you have. It all comes in a nice packaged kit. So that way, it's easy and simple to use. You don't have to worry about it getting messy or anything like that. And it gives you your results in 20 minutes. So rapid testing has become very important for people. I know it's a very nerve-wracking thing already to be tested for, sexually transmitted infections and HIV itself. So waiting that 2, 3 days or a week or so to get your result is very taxing on a client. So we were able to make sure that these tests were rapid tests that we were ordering, and they have become very popular amongst people because they get their results in that moment. So we realized that that was a big factor for clients as well. And the test itself, going back to that piece of people, getting the test kits and not immediately using them, it has a long shelf life. So the test itself can stay shelved for 2 years before it expires. So it allows people to just test themselves on their own time and not feel rushed. Or if they do need to take a rush test, it gives them that rapid result. And then, so what we include in our test kits is a step-by-step instruction sheet. So it gives the directions on how to use the test kit, what to do if, a test, what it looks like with the results and everything like that. We give them a safer sex kit, which at Caracon that consists of condoms and lube. And it also has like a condom tips guide for people who may not know how to use condoms. It provides that extra instruction there for them as well for less riskier practices after they take the test. We also give prep info for people who may test negative. We give them that info in case they realize, like, I really want to give them a prep. I may not know much about it. We give them that prep info so that way they know they have a next step for a negative result to keep them negative. And then for those who may test positive, we also do include newly diagnosed resources. So that way we're not just leaving clients out in the dark if they do test positive on their own. We want them to still feel some sense of security and knowing that they have resources available to them readily and that they can reach out to us at any time. And speaking of that, we also give out our business cards or like staff contact information, just so we don't want clients to feel alone when they're taking tests, no matter what their result is. We want to make sure that we give them that status neutral approach so that way they know what the next steps for their result is. And again, it's just a pain free and non invasive test. It's fast, accurate, and private. You can do it anywhere, the comfort of your own home. We've even had people get the test kits from us and do them at like events and stuff, just because they felt that comfortability with us once we had that conversation with them about the kits. And it just feels a lot more easier and more efficient than getting a blood test done. A lot of people are very squeamish when it comes to needles and things, so we made it to where these test kits would be very easy for people to test themselves. And so, with the popularity of our test kit growing, we have had a demand beyond Ohio for ordering our test kits. So, with our mail in program, we are supporting the Cincinnati tri state area. So, we are able to mail our test kits out to anyone in Ohio, Kentucky, or Indiana. Those are the two surrounding states with Ohio. So, we are able to get those out. People, we get the marketing there, so they know about the test kits, and they are more than welcome to go online and order them from us, and we will send them to them at no cost. And speaking of the marketing, it has expanded to reach different populations in multiple cities and states, and that's through the help of our digital marketing, so like social media sites, dating apps, and things like that. We were able to get the word out a lot further. And so far to the point where we've even had people reach out to us from Pennsylvania, Georgia, Mississippi, Virginia, and Illinois to order a test kit from us. So we went a little bit further with our marketing than we even thought we would, which is a great thing, because we still are able to help those clients who are in those places outside of the tri state area, whether that is through connecting them with local programs in their area that may be a little closer to them where they can get more direct help. Or if, we've had those times where if we did that check with the client and no services existed near them, we still were able to ship that test kit to them at no cost. So we have also so with that, we have sent the test kits to Mississippi and Virginia and Illinois, because those are some places that working with clients, we realized that they were unsupported with the HIV self-testing program. So we were still able to ship them out one to us as well. And it shows us that these test kits are in very high demand amongst people who are either just entering into like the sex life or anything like that, or people who just really want that preventative testing for themselves and just to make it easier for them. And with this is just more information about how we distributed our tests. So with the outreach and mail-in order piece, we also partnered with other local organizations to service their clients better as well. And we found out that doing that, we've connected with people who may not even known about Caracol and our services before. And we were able to train these people at the other organizations on what the test kits were, how they were used, and things like that, to better service their clients who we may not see on a daily basis as well. So that was one way that we were able to do that through third party distribution. The OrQuick company, who is the manufacturers of the test kit, they also have a 24/7 hotline available for questions or concerns about people who take the test kits and may want additional information, or just want to know about like the manufacturing process of them. They have that hotline available. One way that we also realized that these tests are reaching new people are through just simply word of mouth. We go, like I say, we do outreach a lot. We're a prevention team, so we're always out, boots on the ground, doing outreach. We can get one person a test kit, and then they'll yell down the street and send five more people our way. So word of mouth has really been very big on how we distribute these test kits to people in the community, and also give that HIV information and education. Going back to that collecting minimal information piece, again, we figured out that it helps us better with our data if we just get the minimal demographic information we need without delving into people's personal information. Partnering with bars, social events, going to different outreach events, it increases the demand and the awareness for them, because once a client or a person finds out about these test kits. They're so interested in them, they want to go and tell other people at that event or at that bar or at the social event and bring them to us, and we're able to provide them with those test kits. And it just provides them with private testing options. It gives the client an option how they want to test themselves, opposed to just always being susceptible to going to a public space such as a hospital or a clinic. And so we pretty much want to use this information to just say how innovative these test kits have become, especially in more modern times. The marketing data that we have and the client demand for this is showing how HIV testing is becoming self-driven. It's becoming self-driven, and this program has been so popular for us and so high in demand that we are now able to pilot our STI self-testing program that Caracon now has. It is newer, but it is pretty much the same process that we use for our HIV self-testing kits. We're now able to fund ourselves to get STI self-testing kits to give that extra layer of referral, and also options for testing themselves for clients who need that HIV testing, but also that STI testing piece due to like high risk practices. Clients gain control over their sexual health, and that is a big one. We want people to feel empowered, sorry, about their sexual health. And we want them to take control. And we feel like with these test kits, this has given them a new revelation to do that. And we feel like this is why that this program has become so popular for us and for people in our community. And while in-person testing remains important, it reduces stigma when people are able to test themselves. It gives them a way to, just feel private and discreet and not have to worry about, again, that piece of being in public settings, worrying about who's going to see them getting tested and who's going to be there, they don't have to worry about that. So with the test kits, we also know that it has helped destigmatize HIV in a way, not only through the education we provide, but just giving the client that option to just do it themselves. And that has become very important to us. And that we feel like this is why this program has become very important. And it just highlights the growing demand for the accessibility of them, and it's very client centered. And one thing that I do want to mention is that we have a very important group here at Carico. It is our EHE advisory board. They helped us tremendously with the marketing piece of what we wanted to get to people, as far as imagery, as far as wording, even down to like where the locations of where these marketing tools would be. They helped us so much with that they were just off the charts with the great branding that they helped us with. They played a very essential role in that. And to just switch it over to a lot of the marketing piece, I'm going to pass it over to my good friend Josh here.
Jamar, how am I supposed to follow that up? It's an honest question. That was so good. Thank you so much. And thank you for letting me take this ride with you. This program in its second full year has grown tremendously. The work that you do at Caracol, you and your team, adjusting and evolving that program to overcome barriers and meet those needs and be accessible to the community is it's inspiring. It really is. I have a place in my heart for Caracol. I always will. So being able to attend and present with you, like I said, it's going to be hard to follow that up, but I'm going to try my best. So we're going to be talking more about how these programs can scale. And with that, Jamar, you mentioned that there is community outreach and engaging with the community one-on-one is always going to be the most important thing. However, there are communication strategies and media strategies that can help amplify that community outreach to break down those barriers, to overcome that stigma, and create a program in which we are allowed people the autonomy to enter at will, rather than pushing messages of when to get tested, how to get tested, who should get tested. This is just showing options and availability. And what we're seeing throughout testing, Jamar, you did a great job in showing how the trends are shifting from in-clinic to personal or at-home testing. And this is a trend that's not only specific to at-home testing or HIV testing, but in general, just consumer behavior. We are an on-demand culture. We want everything now. If Amazon Prime doesn't have it here by the end of the day, I probably don't need it. And that's a really challenging situation to try to promote health, right? There's a lot of things that people have to overcome. And historically, when it came to HIV testing, it was always on somebody else's schedule. Limited hours. You have to pick up the phone and make an appointment. There's long waits in the waiting room. And oftentimes there's that stigma that's attached with it as well. But the environment, testing has really shifted entirely. Just like people want their Amazon packages within 24 hours, they want that same convenience across all aspects of their life. And we've seen that through the emergence of telehealth programs, and we've seen that through the adoption of larger scale at-home testing programs. But really, with this shifting from this clinic era that requires a lot from the consumer and from our clients and from our community members, we are in this on-demand path that people prioritize privacy. They prioritize speed. They prioritize accessibility. And data is showing, you shared some of these points already, Jamar, but 72% of young adults prefer self-managed health. This is our population that's going to age. They influence older adults and younger adolescents as well. With that, 38% of high-risk adults avoid testing really just due to privacy concerns. And that's data from the CDC. And with that, over 60% of first-time testers prefer home testing over in-person testing. This is a fundamental change, and it's really changing how we approach health and how we approach testing and how we approach using testing as that entry point into the continuum of care. Next slide, please. So over the last 10 to 15 years, the at-home testing market blew up. On the private side with brands like Mr. This is globally a $2 billion industry. That's on the private side. The public sector nonprofits were a little bit slower to adopt at-home testing due to the missed opportunity of reporting test results, linking people with care. But data has shown that this is an effective method to meet people where they're at. With that, the CDC developed the Take Me Home campaign. I'm sure that we've all heard of that here. In the first year, in 2023, they distributed 450,000 kits across the country. And with that, Let's Get Checked program, Q Care Plus, so many different opportunities have created the ability for at-home testing programs at scale. But the issue with that is, does it meet our underserved communities' needs? Does it meet people where they're at? Is it accessible? And that's where local prep programs like Caracol's self-testing program really comes in. We, working at an advertising agency, I do way too much social listening. I consume way too much social media. But with those bigger brands, with the ads that they serve and the posts that they put out there, you see a lot of negative sentiment. It's, oh, I didn't get it for free. I'm not eligible. This is not available in my zip code. I tried calling and I wasn't able to get a hold of anybody. And it creates this situation where this is accessible, but it creates more barriers than it's trying to overcome. The local adoption, such as Caracol's program, really helps remove those disparities. It removes that financial gatekeeping aspect. It offers community and support. It's able to reach people with housing insecurities. It turns that testing into connection and that linkage to care. And really, it's able to continue to transform that data into equity. Next slide. And with that as well, Jamar stole all of the thunder with these results, but within the first 2 years, 2,500 tests from a program that was built from the ground up. And that is really impressive. Over the last year, they doubled the rate in which tests were distributed. Through paid media initiatives, we saw a 97% year-over-year increase of those tests ordered. With that, Jamar, I'm going to put a plug in for Wisconsin. Once you allow that program into my fine state, I will be one of your first visitors to order one of those tests. But 40 zip codes across the greater Cincinnati area with impact that's reaching a large portion of the country to underserved communities. It's that kind of momentum from the national programs implemented on the community level that is really going to be meeting the people who don't have access for these tests and need it the most. Next slide. So with that, Caracol approached KW2 to help them scale this program. The data that they collected and the idea for this program and the way that they're approaching and meeting the needs of their community members created an amazing task. Probably one of my best clients I think that I've ever had working with you folks. You are so smart and so driven, but they wanted to be able to meet people where they're at who needed these tests the most. Being able to reach priority audiences through not only advertising on the radio or at home, but be able to create digital access points for our community members to access health in an equitable way. They put together a very simple ordering form with all the information that they need on the website. Their goal was to drive users to that web page and be able to get people to order those kits. But they wanted to do so that honored their agency, their autonomy, and they wanted to let people engage with health their way. Next slide. So with that, as a communications agency, we really focus on equity. We do a lot of work in the public sector, and a lot of our campaigns that we develop outside of even this program, it focuses on identifying those barriers. As public health professionals, nonprofits, it's easy to home in on those barriers, but it's hard how we could leverage those barriers to drive and motivate action. So identifying these barriers such as stigma or judgments, privacy concerns, limited time or convenience, or even not being represented in the messaging and the ad creative, it gave us opportunities. And we looked at those barriers, and working with Caracol's team, we took out key insights that helped not only frame the program, but help frame the communications around it as well. So instead of people feeling labeled or afraid of being seen, we framed this as testing as self-care. It's not suspicion. We lower the barriers, let them adjust on their terms, and be able to engage this program and platform with complete control, with confidentiality and autonomy. With that relationship builds over time, and more information is gathered over time. What we wanted to do was create a front door in which people could engage health and this program through ease of access. And with this campaign, we wanted to make sure that this was on demand, that it was frictionless, that it was mobile first, it was fast, discreet. And when it came to developing the messaging and the creative, tapping into the EHE advisory committee, being able to ensure that we are speaking to our community in a way that respects their individuality, respects their culture, and respects their time. Next slide. So what did we say? We said, this is health on your terms. We know that when people have the power of choice and autonomy and agency, that they prioritize health. By positioning a messaging around the idea of on your terms, be able to open the door saying it's okay. It's an invitation in. We're not pushing things on individuals. We're asking them to come join us. And that's what Caracol does so well with the follow-up engagement through this program as well. We had one goal. That was to get people through the front door. And we did that. And then Jamar's team expertly helps navigate them through that process and is there for them every step of the way. So with that, next slide, please. We wanted to really leverage this idea that testing is prioritized when it's on your terms. We wanted to put the control in their hands, respect their autonomy, speak with an empowerment, but then also assure confidentiality. So you'll see through messaging, they're simple, but they're impactful. They honor this individual, the individuality of who we're reaching, but then also is able to overcome those barriers simply. So by shifting that power to the audience, it really opens the door for on-demand testing. It opens the door for them to be able to do it with confidence. It gives them empowerment and dignity and ownership of their health choices. And it really helps build long-term trust between Caracol and the community that they work with. Next slide. All right, so with that, I'm going to go pretty quickly here, but Jamar, you mentioned that there was a lot of communication strategies that were used to promote your program and to scale your program, from the grassroots initiatives to community outreach to events to partnership with bars and paid media. That is a great ecosystem to live in. It provides the opportunity for multiple touch points. The work that you do in the community gets that conversation started, right? It raises awareness about this. We know individuals go and tell 5 other people about this free test that they could get ordered to their house and deliver it at no charge. So with that, we wanted to make sure that media was planned to continue that conversation within the community through out-of-home placements that normalize self-testing. We wanted to make sure that this was going to be where people are at, not only billboards, but in transit, in motion, when they're living their life and going about their day, where that it's self-testing is just something that's accessible and normal. It breaks down those barriers. And then with that, so being able to leverage digital spaces that says, okay, you know what's normal now? Here's the front door, come on in. So this media really worked as an extension of the work that Jamar and his team has done on the community level, amplifying that message and allowing people to come on their terms. Next. So with that, the traditional ads through transit shelters, through billboards, through bus wraps or bus kings, to print ads, to hand out cards, media formed so this traditional media approach spanned so many different channels. With that language, be a status symbol, your status, your space. Do it on your terms, echoing that same sentiment that the community outreach team or engagement team says to the members of the community. So making sure that we have these accessible and visible throughout their daily life through radio placements and streaming ads when they're commuting to work or at home relaxing, maybe after having that fun night at the bar, Jamar. We are touching them. That it might be a poor choice of words. We are reaching them at multiple points throughout their day in the context that makes sense to them. So really this visibility builds permission. That testing became a part of everyday life. Next slide. So then how do we leverage digital media to be that access point? We know that a billboard is great for raising awareness, but how do we create a digital point that is going to meet that on-demand culture? We wanted to make sure that working with Caracol that we planned a multi-channel strategy to be able to scale this through social media, through Google, through YouTube, through dating apps, to be able to make sure that this message is reaching at frequency and continues to remind them that like, hey, we are ready when you are. This gave us the opportunity to use contextual targeting that drove in high intent users to the website. And with that, really served as that sort of conversion point for pushing passive interest really into testing orders. And what did it look like? That was a nice transition, by the way. I don't know if that was your slide design, but I like that. So awareness to action. What did this do? I do want to preface this one more time. Paid media does not replace community outreach. It is an extension. However, what we did, we were able to extend that message nearly 22 million times throughout the community, reaching our priority populations and reaching the general community. Through the data that Jamar shared, that there is a large reach and engagement outside of even our key populations. HIV self-testing is something that everybody can do. With that, through this last campaign, we've had the pleasure of working on last year's campaign and this one as well. There's been substantial growth. Over 31,000 individuals engaged with the landing page, showing an 8 times year-over-year growth. What that is showing is it's matching national trends for HIV self-testing. This is something that is going to continue to increase and become a staple in health intervention. With that, we saw increased efficiency with our campaigns, and most importantly, a fifth of all of the individuals that were driven to that site engaged with the program in some way. They didn't necessarily order a test, but what they did was they engaged with the message. They engaged with knowing that there are options available. They engaged with information that could help them take the next step and ultimately lead to 2,500 tests being ordered within these first 2 years by Caracol. All right, I talk a lot and I went 2 minutes over. I apologize. Oh, thanks, Trisha.
Thank you so much, Josh and Jamar. That was a great presentation. I am wondering if anybody has any questions, put those in the Q&A or the chat, and we'll get them to the speakers. But I do have a question. You both mentioned this, the EHE group. Can you just mention a little bit more about what was used and why that group was engaged in this process?
Yeah, sure. So just to give a little bit more background on the group, because I know I kind of said that a little quick. So the EHE group, or the EHE Advisory Board Committee that we have here at Caracol, so they are made up of community leaders, other partner organizations, people who just really support the mission of Caracol. But with the EHE grant, we realized that like a lot of underprivileged communities are not being serviced. So we put together this group to kind of focus on those communities. So this may be people who live in those communities, work in those communities, but they realize that the disconnect between the people who are in those communities and getting tested and the stigmatization and education of HIV. So basically, we use that group to kind of pinpoint us to help us with the wording of the campaign. They helped us map out the locations of where these should be. And we kind of use that process to use our meetings as like kind of like a puzzle. Like we literally put up different um, examples of like what we wanted to use for the media. We put up like kind of different stock imagery that we wanted to use, different wording. And we literally had them go around and vote one by one on each and everything on what they thought would draw those people in those communities in the most. And I will honestly say that they did a wonderful job because after we had that media out, we definitely started seeing the connection between the people in the community and the need and the want for personal HIV testing. So they were a big instrumental part in helping us in selecting how we basically advertise these test kits to people in the community.
Yeah, thanks for that. I was present for that, and I remember being surprised on which images they chose. I had a idea in my head of what images I thought worked best for the community, and I don't think they chose a single image I thought would work best.
Yeah, they had.
Which really
they had
shows
their
why
own
that group is
opinions.
needed.
Yeah, yep.
And then I've got, we'll get to the stuff that's in the Q&A here in just a moment. But one thing that I wanted to point out something, and then I've got a question. One of the reasons that we decreased so much of the information that was being collected was our argument was you can go into CVS and buy these and you don't have to give any kind of information for that. You can just purchase them. So why should somebody who maybe can't afford the $60, $75 for one of these test kits who gets it for free, why should they have to provide all this information that nobody else is providing? So I just want to put that out there. But Jamar, you also talked about the bar testing and stuff. Can you talk a little bit about just kind of what that experience was like and what the outcome was?
Yeah. So like I mentioned before, we kind of did like a trial and trial and error period with the bar outreach. So initially, when we first started doing the bar outreach, we partnered with two different bars that are in downtown Cincinnati. And we had staff go to those bars and like kind of set up a table with the test kits and just sit there for like a couple of hours to try to engage with people to get them to take the test kits. While we did have very few who took them from us, we were still able to engage with them in a way to kind of like open their eyes to know that this type of thing is available and it is free to people in the community. So then on the flip side of that, we literally went back to those same bars like maybe a week later. And we partnered with like the owners, the bartenders, and the security staff that work there. And instead of the staff being present at the bars this time, we literally just made like a sign that basically said like what the test kits were. And we even had like a little QR code there at the bottom so that way they could leave feedback, which we got amazing feedback on. But we gave those bars a certain number of test kits. And so the goal of that was to just see how the difference between a worker being present and giving out the test kits and to where people could just walk up, take them off the table, and do the optional QR code if they wanted to. And we found out that people are more likely to take those test kits when no one is there because of the privacy of it, the discreetness of it, and also being in a public setting like that. You may not want to be seen talking to a HIV care worker. Like, you want that discreetness about it. And we found that, partnering with these places and just dropping off test kits or just setting them up and leaving and then going back to see like what was left or if any were left, which half the time there wasn't any left, that worked better for people in the community opposed to getting that one-on-one type of deal with the workers. And so that is something that we are still continuing to do. And it has become very popular amongst people in those communities as well.
Thank you. And then we got a question in the Q&A about the new STI self-test kit program that we've started, which is in its infancy. But can you talk about what infections that's testing for and how invasive is it? Is it a blood test?
Yeah, so that is a STI self kit that tests for chlamydia, gonorrhea, and trichomoniasis. And with the test kit, it is not a blood test, but however, it's less invasive than actually getting one. So what you would do is just submit a sample of urine for those blood tests. And then you have to go through a process of returning the sample and getting the results that way, which does differ for a little bit from the rapid testing that we do with our our HIV self-testing kits. However, you still get that support and you still get that referral system and everything once your result comes back from that test kit. It doesn't take long to come back. It's just not as rapid as like 20 minutes with the HIV self-testing kit, but it does provide that extra layer of support and resources that we also can help out with as well, even though we are just the distributors of the test kits.
So it does meet all of the needs that we've talked about, these HIV self-test kits. It meets all of those except for the kind of on-demand part, but
Yes.
it's still on their own terms, private, where they want it, that kind of thing. And
Yes.
it's just a function of the laboratory technology that we're not there yet to,
Yeah. And just one more tidbit with those. We get a lot of course, people who come in for in-person and also with the HIV test kits itself. That next step that they always want is additional STI testing. So instead of having to, refer them to somewhere where, they may pay money or they may have to come out of pocket at that moment to pay for those, that's where those STI self-test kits come in as a direct referral that we can get to those people to test themselves on their own as well.
Okay, thank you. And Josh, one last question. You had mentioned that some of the increases that we're seeing here at Caracol in this program are reflective of some national trends. I know that you and KW2 do a lot of marketing for similar organizations to Caracol, health departments, other organizations like that. Can you talk a little bit about kind of just broadly what you're seeing with your other partners in relation to like engagement and self-test kits?
Yeah, absolutely. I think one of the biggest trends right now that we're seeing across the communication landscape is um, the expansion of priority populations and the evolution of messaging when it comes to reaching them. For too long, this has been considered uh, a gay disease, which contributes and fuels that stigma surrounding it. And health departments have always been the forefront for inclusivity and equity. But what we're seeing across the private sector, it's shifting away from those stereotypical ads that are harmful towards the category, actually contributes to the stigma around it, to be more inclusive, which is kind of interesting considering the market that we live in, or the world that we live in right now, is trying to silence individuality. But what this is doing is across the board, the public health pioneers, the nonprofit pioneers that are really pushing for equity are starting to echo that same sentiment. So the best thing I could say is keep up the work that you're doing, that you have been doing, and continue to be the leading voice for our communities.
Thank you, Josh. So we're at 102, so we're over time. Thanks everybody for joining us today. Thank you to our presenters, Josh and Jamar. It was a great talk, very engaging. A lot of great information was shared. Again, thanks everybody for joining us for Caracon Symposium 2025, and have a great rest of your day.